How does the presence of other disabilities, such as physical or sensory impairments, influence the progression and management of dementia in individuals? Anyone can answer this.
When it comes to disabilities, I think it depends on which kind. I know that developmental disabilities, so like ADHD, autism, Down syndrome, they can actually, folks who experience that can have a higher risk for getting dementia. Part of the conundrum that a lot of healthcare providers are looking at now is how do you support someone who's presenting with dementia and one of these disabilities, and which behavioral characteristic is attributed to the disability, let's say, or to the dementia, and is there an overlap? And so I think it still stands what we've talked about here is providing as much support and education as possible, being as knowledgeable as you can when you go into the healthcare system. Unfortunately, with the dementia journey, a lot of onus is placed on the family and the person living with dementia to know about it, because the healthcare system is not going to be able to provide as much support as they can. As the disease progresses and people lose their ability to have mobility, right? Like with dementia, walking becomes an issue later on, so does swallowing, so does moving and all that kind of stuff. That can become more imperative for families to really get a sense of what their loved ones want. Like Charmaine was talking about, and myself, as for example, my father doesn't have the ability to speak or the ability to move on his own, right? So dementia does, not in every single case, absolutely not, but we do see with dementia that mobility is a factor as the disease progresses. So families need to be aware of that and take preventative action. So are you going to have to rearrange your furniture in your house? Maybe you're going to have to get, different ability to walk up and down stairs. All these kinds of accommodations need to be considered, hopefully ahead of time before people have to scramble, when things get worse.
In what ways do coexisting disabilities impact the accessibility and effectiveness of dementia care and support services?
Sorry, what ways do disabilities impact the
In what
accessibility?
ways do coexisting disabilities impact the accessibility and effectiveness of dementia care and support services?
I will say right now, we don't do a good enough job in Ontario of having those conversations and those linkages between agencies that support people with differently abled abilities and the dementia world. We don't talk to one another, right? We don't see a lot of that overlap. So right now, if someone is in an assisted living home for some ability issue and they come to a dementia clinic or they come to a dementia service, they will treat the dementia issue. They will support the dementia issue. The disability issue, unless it's impacting the dementia issue, it's sort of like two different spheres that people work within. Now, not to say that that's right, that's probably the wrong way. And there needs to be more sort of integration of the two. There needs to be more understanding, certainly more research of how one impacts the other so that care providers can be able to support both. But right now, it's still sort of this parallel kind of journey that people have, which is where the knowledge comes in to support people, and which is where community supports also come in to help fill those gaps where they are created.
That's a really good question, and it hits me personally, but sometimes I don't think about it. But having this conversation certainly is really awakening that part of my brain that I've compartmentalized. So my daughter has MS, and she had a brain injury, and in the presentation, the report indicated some 10 years ago that she will likely to develop dementia. I'm gonna get emotional, so I'm gonna probably come offline because it just triggered me because I kind of blocked it to myself. I know you're talking about, we just basically respond to the disability, but never talk to, it's almost like you're blocking it. You don't want to talk about the dementia piece, but she's getting older and sometimes I'm having conversations with her and I get impatient because I'm like, that's not what I said. But it's interesting that you're bringing that, and it really reminds me about how do we address that, because we really, as a family, haven't even talked about it. It's almost like, oh, let's leave that alone. But as we're having this conversation, certainly bringing it right up to the fore, that they did say that she might present with dementia as she get age based on the brain injury and then the MS that was triggered by the trauma. But yeah, so it makes me want to. It is a good lesson for me to remember because I need to talk to our medical team to see how we can actually bring that to the fore. Yeah, but so thank you for that.
Dementia is treated as a separate. So I'm looking in the notes there, and you put there, depression and anxiety before dementia. Depression and anxiety they're risk factors for dementia, and they can also be a symptom of dementia, right? So what happens is that you'll have healthcare providers, mental health care providers, who will treat one or the other. So the question is, how would you treat depression in the context of dementia, right? You would treat the depression, or you would support the dementia. They still kind of keep it separate. We haven't gotten that far yet, I believe, in medical science, where we can fuse the two together and deal with them together. It's kind of one and then after another. And that's kind of the way our coordinated care system works right now. But I do say, you know, at the very basic level, if ever you see anything, if you're feeling depressed, if you're feeling anxious, absolutely seek some support immediately, because we very much do have a higher prevalence, we have a higher risk factors for getting dementia. There's a lot more things against us, so we have to find things that work for us to ensure that we age well.
First question is, how does childhood and adult trauma, violence affects dementia?
There are studies when it comes down to traumatic events, PTSD. When it comes to childhood, it comes down to the risk of how much exposure you have to trauma in childhood. You can have an adverse event, you can have a chronic event. Those do actually have an impact on cognition, but it's not an absolute. Not because if you go through something in childhood that you absolutely will have this outcome later on in life. There's a lot that can be done. There's a lot that can be done to mitigate against the harms of trauma and PTSD. I will say though, in older or adult life and older adult life, traumatic events like concussions, traumatic brain injuries, those are significant risk factors for dementia or cognitive decline anyway. And I just want to be clear, mild cognitive impairment is not the same as dementia. You can have cognitive impairment, which never actually transitions to dementia. So those can be two separate things. But if you do get a concussion, if you get traumatic brain injury, then, you know, seek medical attention, obviously. Try not to get them too many times in life, because that actually can affect risk factors for dementia as well, TBIs. So that's something to be concerned about. And again, when we talk about, and I said before about discrimination as a risk factor, that it's that threat, it's that stress response, it's that inflammation. Like when you feel you're being discriminated against, you're going through threats, through violence, emotional, interpersonal violence, and you get that kind of that bent up response. It's a stress response, which can produce inflammatory responses throughout the body and in the brain as well. So trauma sustained in adulthood could have an impact, but again, it's how you mitigate against that, the protective mechanisms that you can do to slow the progression or even starve off the onset of dementia. And there are some things that you can do.
Thank you. There's a question here that the dementia patient receives support, but what about the caregivers? What kind of support do the caregivers get?
Yeah, so the Alzheimer's Society and many other community-based organizations, they do have support groups. So the Alzheimer's Society at any one of our local societies, so we have the Ontario, which is the provincial bench, we have Toronto, Peel, Durham, York region, etc., all over the province, and they have support groups. So you can go online, they have them on Zoom, they have them in person, you can go in and you can sit and listen to other folks who are in the same or similar predicament. And for me, I can honestly tell you, it was the most validating experience to have other people understand the words that were coming out of my mouth and understanding what I was experiencing and what I was feeling. Community-based organizations, they also have some of them, not all, some of them have support groups as well. They have older adult programs. I will say as a caregiver, it can feel very overwhelming. It can feel like it's your whole life. Like physically, mentally, emotionally, all you're doing is thinking about the person with dementia, your parent, your grandparent, or whoever it is. And I will say that it is very tough. I'll be very honest. It's very tough to find a minute for yourself, to find a minute to remember who you are, to find a hobby you used to like to do, or even eating a food that you used to like to eat. But I will say, having been on this journey, wherever you can find yourself having 5 moments even for yourself, take it. Even if it's 5 minutes in the shower, 5 minutes in the car, take it. It really does act as a protective mechanism for all the stress that you are going through with dementia. It acts as a way to keep you going. It kind of reinvigorates you to keep you going for the next little bit. I would say reach out to friends and family, anyone who's trusted, who you can, lean on and talk to. there are supports for caregivers. There's also respite services. I know now in Ontario, they've cut back a lot of funding. CCAC, Ontario Health, they used to have PSW hours that were more plentiful. You could apply for respite programs, Recharge. It's called Recharge is one of them. Some hospitals also offer them. I think Baycrest offers some of those programs, Mount Sinai as well. So look into whatever local hospital that you are connected with, if they have any supportive programs for PSW support to come into the home as well. Victoria Order of Nurses, Vaughan, I think they also have some programs as well to support family members, providing that support in-house. Charmaine, I don't know if you have any other information.
Actually, I'm writing them down because I didn't even know about those. I just wanted to say, as individual and as people in our community, I know it was a great thing when I could say, I go Mondays to do whatever my stepmother needs. And I remember one time all she wanted to do was sleep because she was so tired. So yes, anytime, one thing, it's hard because, okay, I don't live there, but my nephew lives there and my stepmother there, and they have the brunt of everything. I mean, it's hard when you're a young man, like you're in your 20s and you're the one driving your grandpa here and there and here and there, and it's really challenging. So we have to just remember that really just reaching out to our family members and friends and saying, can I help you? You don't know how much it helps, because then they get the opportunity to go and feel normal for for some moments. Like it's really important. So seeing my stepmother going through so much, and asking anytime I can help to go and help, it just really helps them, so that, just even to get away for a day. But also, I didn't know about all these things. I'm like thinking, if I had known, then we could, give this resources to her. So I don't know how we can get those resources out, or this information out, so that others can know, because I know there are other people that probably taking care of someone, and I didn't know of any of these things. So getting information out there, however we can, will be vital to helping the caregiver get some support.